For today's segment, we're going to talk about shoulder impingement, as it's a common pathology that we see in the clinic, as well as a common thing that overhead lifters, crossfitters, overhead athletes typically have to deal with at some point in their lifetime. So typically, shoulder impingement is caused by a variety of things. We'll talk about each of those as we go. But to start off, I just want to talk about kind of the presentation. So generally, when someone has a shoulder impingement during the mechanical stage, so this is when if I do a movement, it hurts like that, so that's what mechanical means. They'll typically have pain in this painful arc that we call, which is from 60 to 120 degrees. So they'll generally, as they're raising their arms up, they'll have pain from about here to about there, and then no pain. So if they have pain while lifting in this general area, it's usually a good sign of shoulder impingement. It's also typically pain that is associated right here around the joint where the tendons are becoming impinged. Usually the rotator cuff tendons. The most common one is supraspinatus. You can also have subscapularis or infraspinatus, which are also common ones. The next thing we're going to talk about is kind of just the posture that most of these athletes or individuals are in. A typical pattern that we see with many people who sit for a long period of time is the rounded shoulders and the forward head posture. This is typically caused by tight muscles and weak other muscles. So tight muscles in the front, pulling your shoulders forward, weak muscles in the back that we never use, pulling ourselves back. As we know, everything we do in life is in front of us. Typing on our computer, our phones, as we drive, we spend a lot of time in front. We never spend any time working our muscle in the back in our daily lives. So typically, most posture are typically kind of this slouched, forward shoulders, and a forward head posture, when it should be up a line like this, so that everything is in a line all the way down. When our shoulders are rolled forward like this, even while we're standing, they're just rolled forward. When you try to go up, you're bound to impinge just by the biomechanics of it, when our shoulders should be back so it can be raised. There are a few impairments that typically lead to shoulder impingement. These typically are either mobility deficit, that anterior translates the humerus forward in the joint, which leads to altered biomechanics, or more scapulohumeral rhythm, which has to do with the coordination of the muscles to get the upward rotation to elevation that is required to not impinge on the rotator cuff tendons. So we'll take a look at each one of those separately and kind of show you how to analyze and also treat them. When assessing pec minor, you want the patient laying on their back, and then you're going to measure the distance from the ground up until their AC joint and see what the distance is. Normal is about 3 fingers width. Any higher than that usually indicates a tight pec minor. So it looks something like this. You lay down here. So as you can see here, in just rest, I'm about 3 fingers. A tight pec minor would be up more like this, where you can fit 4 to 5 fingers underneath the spot from the AC joint, which is here. When assessing pec major, there's 2 ways that you can do it. If you're a therapist, you can either tack down the rib cage or the sternum to prevent those from flaring up as you go into the motions, or if you're by yourself, you can contract your abdominals to hold down the rib cage to keep them from flaring as you go into the motions. When you're looking at the clavicular fibers, you're going to go straight out to the side, and when you're looking at the sternal fibers, you're going to go up overhead into a more of a diagonal pattern. The key is to get down to neutral. If you can't get down to neutral without the stretch or the ribs coming up and flaring, then you have a tight pec major.
As you
And
can
it would
see
look
here,
something like
I'm going to tighten my abs, and I'm going to kind of hold down my sternum to kind of do a combination of those two. As I go out to the side, I get to neutral, full range. As I come up here, I stop about right there, showing that those are a little tight. If I weren't to control my abs, I would be able to get all the way down by arching. You can see my ribs flare a little bit right here, and I arch my back. One of the best ways to stretch your pecs is going to be over a foam roller or just some sort of round circular device. You could roll up a towel, as long as it has enough of a diameter to kind of get that stretch in your chest. I don't have my foam roller with me, so I'm going to use this. So you would just place it down there. Line your back up over the top, and then bring your arms out to the side. This just allows the chest to open up you'll feel a stretch all in through here, and you're just going to hang out there for up to a minute. Research has shown that stretching needs to be held for at least 30 seconds. I always like to prescribe to tell patients let it stretch until you feel that there's a change. So once you're stretching, you start off feeling an intense stretch. Once you feel that the stretch is less, that would be considered therapeutic in my eyes.
The other pec stretch that I like to give to my patients is using a wall. So I tell them to bring their shoulder in front of the wall as to block the humerus from translating forward. Many people, as they stretch like this, and all they're doing is bringing that anterior humerus, letting it translate forward, which can cause irritation to the biceps tendon and a couple other things there. So this is fine, even more for pec major, but especially if you want pec minor, you need a block here, and then just rotate away. And as you rotate your body away, you'll feel that stretch right in through here. Just like before, hold it for at least 30 seconds, or as you feel therapeutic. If you don't feel a stretch there, then feel free to try this. For this segment, we're going to look at the posterior capsule and the posterior cuff musculature. Posterior capsule would be in the joint. If the posterior capsule is tight, it'll tend to have a tendency to push the head of the humerus forward in the joint because there's not enough room in the back, causing an impingement through there. The posterior cuff musculature is going to include the teres minor, teres major, infraspinatus, supraspinatus, posterior delt, basically any musculature that attaches from the scapula to the humerus. And if these are tight, then it'll cause the scapula to be abducted instead of in its natural resting position. So we're going to take a look at how to assess both of those. Posterior capsule, you're going to be doing something similar to a sleeper stretch. You want to bring your shoulder to about 90 degrees. Make sure you're rolled on top of it to keep it from rolling forward. And you're going to bring your arm down like so. So as you can see, I also have a little bit of restriction here. A lot of the time you can be restricted from overhead, being an overhead athlete as when you're younger and growing, and that can limit some of the internal rotation range. But so you want to do that. If you're able to get down to the ground while keeping your shoulder down, then you have plenty of range. If you're not, then you may be a little tight, and the way to stretch that is just by doing this stretch. So you would want to hold it, and for this one I kind of like to hold it and then just kind of go back and forth like so. The same thing for about 30 seconds. The next one is the posterior cuff musculature. You're going to be in the same position as here. You're going to take your elbow, and you're going to try to bring it across like this, and you'll feel a stretch in the posterior shoulder area. Laying on your shoulder just keeps it so your scapula is not able to protract. You should be able to get to about mid-body or lined up with your nose. If you can't, then it's probably a little bit tight. And same thing, you would just work on stretching it.